This presentation documents an interview with a social care practitioner on the path of her career in clinical psychology. It gives insight to how she developed her professional identity. The presentation will illustrate practitioner information, career development, and her current role. It will then highlight the practitioner's own experiences in relation to theories relevant to social care. The practitioner involved is a 49-year-old female who has been in the field for over 23 years. She studied at Queen's University for 9 years, and her qualifications include a degree in Bachelor of Science Psychology, a doctorate in philosophy, and a doctorate in clinical psychology. She began her journey as a paid trainee in clinical psychology for 1 year. She then worked for a clinical mental health team for 2 years and got promoted to principal psychologist in a primary care setting. After 4 years, she then got promoted to consultant lead clinical psychologist in an adult therapy service. She has worked in this position for over 10 years. Her current role involves clinical leadership and governance of an adult psychological therapy service for the Western Health and Social Care Trust. A lot of her work in the area of supervision and management meetings alongside a small caseload of about 8 patients. When asked if she always wanted to play this role, she said she first wanted to do probation, however, with research she found clinical psychology was much nicer. With regards to professional boundaries, she does not find them difficult to keep. She states it is essential to my work as a therapist that my position as a helper is maintained for the treatment to be effective. The relationship between the therapist and their client must always stay inside the room. When asked about dual relationships, the professional said she does not have them with her clients. Life has already been stressful for the client, and this can cause confusion and added stress. It is absolutely crucial that boundaries are kept. She does, however, have dual relationships with her colleagues. She is working with a good staff team and finds it important to socialise with them outside of work. The practitioner spoke about the gifts policy when a client had bought her a gold chain. Therapists can accept small tokens, however, on a continuing basis. She thanks the client for being thoughtful and is firm in explaining trust policy on accepting gifts so as not to offend. An ethical dilemma she faced concerns fourth-hand information. She was told in supervision a client spoke about a previous psychologist, friending her on Facebook and putting up inappropriate posts. Legally bound to pass this information on, she spoke to her lead manager, who then passed on the information to relevant authority. When asked about rural practice, she said this is not really an issue as she lives in a large city. It is important, however, to be mindful that it is possible to bump into a client or a former client. If this happens, she maintains a level of professional conduct by acknowledging and greeting them, but not getting into a conversation of how they are doing. A threshold concept can represent passing through a portal, opening up a new and previously inaccessible way of thinking about something. It represents a transformed way of understanding something without which the learner cannot progress. The professional described her threshold concept when working with clients with borderline personality disorder. This disorder can be challenging to treat because of its nature. The effects, including cutting, burning, and other forms of self-harm, she explained as conceptually difficult. She then learned a specific set of skills in treating these clients through schematherapy training and dialectical behaviour therapy. Vicarious trauma is a transformation in the self of a helper that results from empathetic engagement with clients and the reports of traumatic experiences. It is a special form of countertransference stimulated by working with traumatised clients. The professional experienced this in the first 2 years of her career when working with children who had been sexually abused. She was distressed at the information being disclosed, having complete empathy. Additional supervision with a professional specialised in the area was crucial to helping her relieve stress in a confidential manner. It also motivated her to gain extra training in the area of sexual abuse on children to better equip her with treating these clients. Some of her self-care strategies include Pilates, walking, supervision, taking 1 month unpaid leave every year, tight boundaries between work and home life, good professional and personal support, does not take work calls at home and maintains work hours. On the matter of reflective practice, the professional stated that the job can be confrontational, stressful, and can cause anxieties. She explained that it is absolutely necessary in exploring why you feel the way you do. You must be open, honest, and reflect on why you may not like a person or a particular client. Supervision is key in creating awareness of how you are with people. The practitioner interviewed explained how her professional identity is maintained and evidenced through continued training, learning new approaches to therapy, clarity of roles, approaching staff to engage in self-care activities, fair and transparent procedures, and working with supportive organisations. The practitioner explained how her role changed how she sees the world when treating people who have been abused. It affected her trust in people when she learned most abusers were people the clients knew, like the family, a doctor, or a priest, and stated you don't really 100% know someone. Her role influences the way she sees herself in a positive light as she has transformed so many lives, and explains this is a great feeling to have. She says you can do a lot to help people and change the way they live their life. In the job role, you also learn a lot about yourself and why you wanted to go into the caring career. It also helps you find your strengths and weaknesses and build on them. In ending the interview, the practitioner talked about some of the key learning experiences as a professional. The relationship with the patient is key, the importance of ongoing professional and personal development, continuing training and reflection, and good self-care.